Very pleased to have as our first guest of the day, Dr. Ronald Kapp. Dr. Kapp has written an interesting book called The Rally America Tour. We'll let him chat about that. He also is in charge of PreMed Life Support, and he's a coach of students who want to get accepted into medical school. And we welcome Dr. Ronald Kapp to the Mike Shickman Show. How are you today, sir?
Well, Mike, I'm wonderful. It's great to be in Virginia.
It's great to have you on our program today. This is something that is fascinating to me because over the last 5 to 7 years, it seems many more physicians are leaving the world of medicine. And with the med schools being the way they are, it doesn't seem like there's enough replacements.
I think you hit the nail on the head. A lot of physicians are leaving, but it's my theory that they may have been the wrong physicians in the first place. I am convinced medicine is one of the greatest professions there is. It's so rewarding. I talk to young students, and I try and get them motivated, and they say, well, I hear doctors are leaving. I hear electronic records are difficult. I hear it's malpractice, insurance companies, pharmaceuticals. It's taking $3 trillion of our gross domestic product just to keep us living in America, and yet we have the worst health care in the world. But when you look at it from a perspective of a student, it's a fascinating journey to go on because it truly is a journey that I think many students need to think more seriously about for their career choices.
The biggest difference today than 8 to 10 years ago is that many more private or small practices have been bought up by the to paraphrase Clark Howard, the monster mega hospitals. And it's a lot tougher to be a sole practitioner.
You're right, it is difficult, and yet I still see patients one-on-one. I work for large groups, quite a few different large groups around the country as an emergency room doctor. I still do that. When I sit down with a patient, we sit down one-on-one, just like you're doing with me right now, talking about medicine, talking about illness. I think it was Thoreau that said, wealth is health, healthy, wealthy, and wise. People come to me, they have a crisis in the emergency room, and if I do my job properly, I can help them solve that. That is tremendously rewarding. So on the personal perspective, it's great. As long as you don't get lost on the bureaucracy, the politics, and the financial incentives. We have a medical industrial complex that's truly out of control. You see it on the news every day. Obamacare, call it Trump care, if you will. They're asking the wrong questions. The true question that needs to be answered is, what is it you want to do with your life? You go to a young student who's 18, 19, 20 years old. They have very little experience, but many of them dream about being doctors. So I say, well, if you have a dream, let us see if that dream is appropriate for you. I don't think it's difficult to become a doctor. I think it's not even difficult to practice medicine if you have the passion for what you're doing. And it's passion that drives everything. So if doctors are leaving, I think they're just missing the passion is my point that I'm trying to get to.
Dr. Ronald Kapp, our guest, he is in charge of a website called PreMed Life Support, training elite students for tomorrow's practice of medicine. Among your books, training elite students for tomorrow's practice of medicine, the competitive edge for medical school acceptance and beyond, called PreMed Pearls, and then PreMed for parents, what you need to know when your child says he or she wants to be a doctor. This sounds like it has been a lifetime journey for you.
Well, it has been, Mike. I did not know what I wanted. I went to Ohio State, and I was confused like so many students. Took a variety of courses. I went to the PreMed office one day, and the advisor there said, you can't become a doctor. You don't have the grades. You don't have the intelligence. And that upset me a little bit. it was sort of a challenge. I said, well, maybe I do have a destiny more than what you know. Can I make that destiny be mine? I asked myself, can I make a difference? And if I can make a difference, how do I do it? I do it through step-by-step process of seeing what needs to be done, how do I do it, and what am I getting into? Medicine is a 40-year career. If you don't know what you're getting into, it's a big mistake for these young students because it may not be their destiny. They may not have the passion. But when I sit down with a student and ask them, what is it you want to do with your life? Inevitably, we come to the conclusion they want to help people. Money occasionally comes up. Oh, yeah, I want to make some money. But really, the number one driver for the motivated students is they want to serve, be a humanitarian, help people, either one-on-one in a clinic, doesn't matter where. And that then gives them the energy to push through the hurdles, the pre-med process, the medical school process, the internship and residency years, because it is a long road that they're going down. But it's such a great road, and there's so many things we can now do with medicine, with the technology, the CT scans, the MRIs, the PET scans. Couldn't do that 30, 40 years ago.
You know, it's ironic. It's ironic because you talk about becoming pre-med, and I remember thinking about pre-med back in the day when I thought I was smart, and every pre-med student told me the same thing. You're fine until you hit organic chemistry, and then all bets are off.
And that's such an artificial metric that we use. I am convinced you don't need to be brilliant, a genius, have a great IQ to be a doctor. You have to have a good memory. But the real key you need is caring, empathy, humanitarianism. And anybody can do medicine. We can get through the coursework if you work at it. Study hard. It's not an easy road, but it's not that difficult. They prepare us appropriately. The medical schools in our country are fantastic. They really do prepare us for what we're going to be doing. The problem comes up as an undergraduate student. They're in this, I call it an individual educational silo. They're all by themselves, studying and competing, just like you were. Then you hit organic chemistry and you get a B or a C. But when you get done with your educational system, then you join the teams. You're in a team approach. You're having to work with nurses, physical therapists, radiology tech, lab techs, administrators, medical records people. And doctor is just one component of that entire organism. So if we could take students.
Doc, you there? You are breaking up, but we have a middle of a thunderstorm here, so it's possible that it's us. Are you there?
And I'm on the West Coast where it's sunny today.
Well, right now we are in the midst of a thunderstorm, which is could be why you're breaking up a little bit. Before I let you go, because I did want to ask you about this, what is the Rally America Tour?
There's a book specifically for pre-med students, but it's also applicable to tennis. My tennis partner and I were sitting there one day, and we said, what are the limits of human physiology? And can we hit a tennis ball a long time? So we spent the summer of '97 traveling across the country, 48 states and 48 days, and we were in Tallahassee, Florida, hit a tennis ball for 9 hours and 15 minutes before we decided to stop. Didn't change balls, didn't miss, played a USTA type point. But the idea was we had a thought, we had an inspiration, and then we took it to fruition by massive action. We solicited sponsors. We had the USTA, we had Adidas, we had Wilson, we had Penn. All the sporting good companies were behind us. But we took our idea and made it real. And pre-med students can do the same thing. They can take their idea of, I want to be a doctor, I have a dream to be a doctor, and I'll make it real. I just have to figure out how to do it.
What is the best advice you can give someone who wants to become a doctor?
Get as much experience as they possibly can on what they're getting into. Some students shadow other doctors. That's not enough. The students really have to delve into what they're getting into. They have to see patients. They have to talk to patients. They have to talk to doctors. It has to almost go back to what it used to be, where we would do an apprenticeship to learn how to be a plumber or an electrician or a carpenter. I'm convinced pre-med students need to do that again, and we won't see this high dropout rate in the future. They have the ability to solve our healthcare crisis. That crisis will not be solved in Washington. It will be solved by each individual doctor finally standing up and saying, this is my profession, this is what I want to do, I'm going to make it great. We make America great, we're going to make medicine great.
Dr. Ronald Kapp, where can people find out more? Where can they get your books?
They can look on the internet under Dr. Kapp. Amazon sells them. They can contact me through the website, PreMed Life Support that you mentioned. If you Google my name, it'll come up on the internet, and I'm open to anybody. I talk to everybody for free.
Dr. Kapp,
I'll be inundated with phone calls now.
There you will. Dr. Kapp, a real joy. Continue the good work, and thanks for being with us.
Okay, thanks, Mike. Have a good day.
You too. Dr. Ronald Kapp joining us today. Go to PreMedLifeSupport.com.